Hello, everyone. We're doing a series on your consultations, and these are based on questions we get a lot, what I see in the office a lot, and one of the increasing issues in today's world are young women with significant period symptoms. And what are period symptoms? Look, symptoms, they're not normal. You're not supposed to have these things. PMS, okay, and look, a little bit of emotional, a little bit of this and that is not abnormal. But if you're having significant PMS, if you're having significant cramping when you have your period, if you're having significant bleeding, heavy bleeding, clots, or just heavy bleeding, significant discomfort, if your breasts are getting tender and enlarged to an extent that you really notice it, it changes what you do while you're having your period. If you have long periods, those are symptoms. And what does that mean? Number one is, and you shouldn't have them. So does exercise help? Absolutely. You are what you eat. Food is your medicine. Eat right for your blood type. Make sure that you don't have any symptoms of gas, bloating, constipation, food sitting in your stomach, because that's going to contribute to your hormone levels being askew, not right, in other words. If you're all stressed out, that contributes to it. Some people are more sensitive to others, and those are genetics. Some people, nothing seems to bother them. They all do well. Other people, the least little thing, they look at a picture of somebody having a problem, and they've got a problem. So, adrenal life force, very important for the stress that contributes to it, okay? In my world of dealing with patients, and never mind people I know, everybody needs to be on adrenal life force. Omega-3 fish oil, 1 pill a day, it makes everything better, pains, etc. Vitamin D, that really matters. Most of my patients, I tell them to take 5,000 IUs a day, but again, and on my website, that's 1 pill a day, but again, you need to have a vitamin D blood level done, because we individualize that to a certain extent. The more active you are, the more vitamin D you usually require, but those levels do need to be checked. The other thing is antioxidants, glutathione lozenges, vitamin C, all those things really help. Not eating a bunch of sweets, foods that you're allergic to, etc. Because what do? They inflame you, and those imbalance your hormone levels even more. And if you're more sensitive, you're the one who's going to have more problems. But when people have PMS, enlarged breast, sore enlarged breast, heavy bleeding, cramping, that means your progesterone level is low. There's a reason I have progesterone support on the website. And that's because I have so many people who have period issues, and it's a symptom. You shouldn't be having them. And my job is to make you better and to identify why do you have it. So when you're young and your progesterone is not right, your level is too low, there's a couple of reasons you may have it. Number one, your thyroid may be low. First thing I do is always treat the adrenals. I give people iodozyme, 1 pill 3 times a week. See if that makes their thyroid better. But if you have the symptoms, and all the symptoms are on the website of low thyroid, then I start with thyroid support, 1 pill every other day. And I let them go through a period, see if the next period is better, because that's the only way that you can tell. Because if your thyroid's low, you don't make enough progesterone. It's a secondary issue, and that's why you have those period symptoms. Now, I have some people, I've optimized everything, and what I have to put them on is progesterone support. That progesterone support, you start out So, what I ask people is, okay, in the middle of the month, can you tell if you ovulated? Do you feel pain? Do you have symptoms, that middle schmerz? You should look that word up, it's a great word. Where you get terrible cramping in the middle of the month. That usually means your thyroid's low. You still first treat the adrenals, iodozyme, and then you go to thyroid support. And do your symptoms start at day 21 of your period? If day 1 is the day your period starts, if day 21 you start getting symptoms, that means your progesterone is too low. That's when I start giving people progesterone support, 1 pump every day until midway through their bleeding. And if you use progesterone support, all your symptoms get better and your heavy bleeding gets lighter. Too much progesterone, your period gets really light. It'll come back, you just reduce your progesterone a little bit, but the worst thing that you can do is decrease the heavy bleeding. Hallelujah. You don't have all the symptoms. And so progesterone support, again, I start out with 1 pump a day. I may start at day 21, and then I let people go through a period. If it made it a little bit better, but it needs to be a lot better, then I start the next period, day 14, using progesterone support. Progesterone support is also nature's tranquilizer. It gives you inner peace. Take it at bedtime. You rub it on your skin. You can put it on your face. You can put it anywhere on your body. It helps you sleep as well because it's nature's tranquilizer. It helps life not upset you so much. It helps husbands, children, boyfriends, whatever you've got, bosses, co-workers. It helps them not upset you so much. So good side effect to have, but you have to find the right dose for you. So again, I'm starting at day 21, but after I fix the adrenals, iodozyme, I'm using anti-inflammatories, glutathione, camu. If I could only choose one, I would do the glutathione. It's also good for your skin, anti-aging, a lot of things. So that would be where I'd start. I'd be on my vitamin D. I'd be taking 1 omega gold per day because that helps all your symptoms. Plus omega helps your thyroid. Plus omega is good for your skin, good for your joints, etc. And then I would start with progesterone support, 1 pump, day 21. Do that and go through a period. If it's not enough, go to day 14. You can always go to 2 pumps, but that's how you start. That's why progesterone support is there. Those are symptoms. They're abnormal. You're not supposed to have those symptoms. People are not supposed to have these heavy, painful, dysfunctional, where they're emotionally they can't cope, periods. So hope this helps. Knowledge is power, and I'm trying to teach you how to help yourself as well. Thank you so much.